Clive? Yeah, I didn't hear anything about storms up in Birmingham either. I live just outside of Birmingham, so I think we got spared, but I dig your humor, sir. I'd like to welcome everybody back to Alabama Care. Today we have Mr. Steve Hamerdinger, the Director of the Office of Deaf Services at ADMH, and we're going to be talking about mental health crisis and the deaf community today. At this point, I'd like to hand it over. Mr. Hamerdinger, if you would introduce yourself.
Hello, everyone. Thank you Alex for inviting me today. My name is Steve Hamerdinger. As you said, I'm the Director of the Office of Deaf Services. I've been in this position since 2003. Prior to that, I had a similar job in the state of Missouri. From 1993 to 2003 there, and then I moved here to establish the program in Alabama.
And are you originally from the Southeast?
Actually, I initiated in Washington, D.C. I was born and raised there, near the D.C. area, moved to the Midwest, lived there for a while, got my master's degree in counseling, moved on to New Mexico. I worked there as a child and family therapist for a number of years. I then went back to Missouri to lead their Office of Deaf Services.
So the only place you have left is the Pacific Northwest.
I think I'll skip that particular one.
I grew up outside of Philadelphia. It's a beautiful part of the country up there in the Northeast. Kind of did a little bit of the same, living in Alabama now, but lived in Phoenix, Arizona for a number of years. So we've kind of toured the similar areas of the United States there. Well, I want to say thank you for being with us today. And it sounds like a lot of your career has been in the community serving and helping the disability community or those kind of less fortunate there. What was your drive to want to get into this career and serve in this capacity?
It seems more like the career chose me as opposed to me choosing it. Things just work out some way.
Yep. We'll take 1 second. He's resetting the microphone there. I apologize for the audience. We had a little flare up of the static on our wireless mic, and so we're good to go and we're back at it. Sir, I apologize.
Where do I begin? I was born with a progressive hearing loss, became completely deaf sometime around the beginning of school, but it was unrecognized by my family. Within school, I struggled a great deal, but somehow I was able to get by until I get to high school. At high school, I struggled a great deal. On my 16th birthday, I went into the principal's office and I said, I quit. I just was not able to deal with the stress of doing that anymore. My parents were unhappy with me at all, of course, as you can imagine. They gave me a choice. Go back to school, complete that, or find a job. Or move out on the street was the third option. I found a job. I worked as a janitor for a while. I worked at a janitor for a large church in Washington, D.C. Vocational rehabilitation found me. Somehow they decided that I was worth the investment to put me into, to get my degree and go on into college. I went to Gallaudet University initially. At that time, it was still just a college, not the university at that point. I was a 16-year-old kid at college, so that was an interesting experience. Through the progress, I did not know sign language at that point until I came to Gallaudet University. It was not a little bit of the background. Gallaudet University is the only liberal arts college for deaf individuals in the world. Everyone there knows how to sign. I came in without that skill. I was obviously lost. Fortunately, there were people there who were friendly enough and welcoming to allow me to immerse myself into the deaf world. And I picked up sign language very quickly. I left there to go on to seminary. My bachelor's degree is actually in theology. What can you do with a BA in theology? There's not much you can do. But that kind of tracks. I went on to college looking for something, what I wanted to major in. I figured history, perhaps. The same question was posed, what do you do with a BA in history? There was really nothing I could do with those individual things. Then I ended up with the idea of maybe I'll major in philosophy. You can ask me the same question, what would you like to do with a BA in philosophy? That's what vocational rehabilitation continually asked about there. I ended up going to seminary to major in theology as a result of that. Truly enough, what do you do with a BA in theology? I went to work at Kansas School for the Deaf, worked as a dorm supervisor there with students in the middle school age. It was a fun group to work with. Anywhere from ages 11 to 15-year-old boys. Very, very interesting to work with. I coached basketball, coached football. I did that for 9 years. At the same time, I went back to Gallaudet University during the summers to pick up a master's degree in counseling. From there, I moved on to Santa Fe, New Mexico, established the School for the Deaf there in New Mexico, working as a child and family therapist. The staff of New Mexico was a very heavily influenced by both Hispanic and Native American, specifically Navajo, cultures. It was a huge culture shock for someone like me, a white boy from the Midwest. But I was fascinated by the experience. In 1993, I ended up moving to Missouri to run a program there for deaf services under the Missouri Department of Mental Health. That's what got me into what I do as a director.
That is quite the story, sir. And I want to ask a few questions here. You said you really enjoyed that dorm supervisor role and being able to make an impression on kind of the adolescent youth there. It's a very growing time in one's life. Did you have any access to any of that when you were in school?
Oh, no. No. As a deaf kid living in with hearing family, 97% of, I was different from 97% of most of the deaf children there. One advantage I did have, obviously, is I was not born deaf. I was born hard of hearing. I was able to pick up some aspects of language through that manner. My parents also were avid readers and insisted upon that to develop my English skills. Many deaf individuals, many children, do not have that advantage. Have you ever seen the movie Mr. Holland's Opus? Have you seen that?
I have not, no. It's on my list now.
I would strongly recommend that. I would strongly recommend seeing that. There's a segment, a scene in that movie where the parents struggle to decide how to educate their child who is deaf. This child is 5 or 6 at the time, and they're still struggling with the decision of what language to use for this child. That is a common occurrence for many deaf individuals. Many children grow up with heavy language delays, language exposure deficits. It's a big issue we see a lot with the deaf community still today, and it's occurring more often as we even talk now. We're seeing more research in that area. How disability impacts a person's mental wellness. That research is showing that with deaf individuals. Just simple as access to language, how that little thing can actually impact a person's view of the world.
Access to language. I've never heard that phrase before. Could you dive in a little bit more there?
Well, sure. When a child is deaf and parents don't sign with them, where's your exposure to language?
You're not absorbing those words. You're not getting that mental stimulation that helps in those early years.
Exactly. That has tremendous impact on neurodevelopment, tremendous impact on psychosocial development. It has a host of other potential pitfalls that come and consequences. I mean, you can imagine if all you have is something you can see, touch, smell, and taste, where you get other experiences.
Yeah. And so it's so important if a child has hearing loss to surround them or get them in touch with somebody that can communicate with them and speak with them in that language so that they continue to have that growth there. Now, did you have anybody in your youth before you got to the Gallo Arts? Was it the university there, the college?
Gallaudet.
Gallaudet. Did you have anybody in your life that you could speak with and sign with growing up before you got there?
I did not. No.
What did it feel like when you went to that college and were able to communicate with others?
How would you feel if you went to the first day of college in Japan and you didn't know Japanese? You were just placed into this environment. That's how I felt initially.
Yeah. Does it, looking back now, does it feel more like a home though, a good transitional spot for you?
Absolutely. Absolutely. Free access to information all around you. I wasn't limited to only what I could read. I had access across the board. I could step in on a person's conversation if I needed to. It seems silly, but a lot of what we learn is not from direct instruction. A lot of it is what we overhear in the environment. You know the old Rolling Stones song, Satisfaction? There's a verse in that. Driving in my car, the man comes on the radio, tells me more and more about some useless information.
Yeah.
That's how you learn things you hear. As a deaf individual, I don't have access to that.
Yeah. So you asked me how would I feel if I was put down in Japan in a college over there. I think I would start learning more from the casual conversations in the hallway than reading out of a book and hearing a teacher repeat what was in the book.
Right, absolutely. It feels more comfortable when you learn that socially. Many people ask me how long it takes to learn sign language. In my case, it took me about 18 months really to immerse myself until the light came on in my mind.
Yeah.
One day. That first 18 months was a struggle, being exposed to it on a daily basis.
Now, if I'm learning, I took Spanish in high school and college a little bit, but it was easier for me to read the language than it was to speak or hear the language. Did you notice it was easier for you to see and read the language than it was to use your hands and speak the language?
At first, no. At first, it was easier to express my thoughts. Just like most people, when they learn a second language, they find themselves able to speak it better than they can understand it.
Okay.
It's similar across the board. American Sign Language is a formal language. It's learned in many of the same manners as any language. Dr. Sanjay Gulati does some work on language deprivation at Brown University. It's available on the internet for a search if you wish. He talks about how deaf people process language in chunks towards the frontal part of the brain, similar to where hearing people process language when it's done orally. In sign language, they think the visual portion of the cortex towards the back of the brain should be where it is, but it's an interesting fascination to find where that happens. It's interesting how we provide services to deaf individuals as well. It has implications towards that. It builds on the concept that services need to be provided in the individual's native language by those who are fluent in that language. It's not so different from a Spanish speaker providing work with Spanish-speaking individuals. It's the same concept. Ironically enough, Alabama is one of the few states that actually does that. Most people think that it's good enough to bring an interpreter in, but it's not.
So kind of taking a step back, you dropped out of high school and you ended up getting back into the education system, getting a good community around you, and you are now the director of the Office of Deaf Services here in Alabama. You're the director there in Missouri. That's quite a journey there, sir. And if you could give a little bit of background for anyone that's unfamiliar with the Office of Deaf Services at ADMH, and if you could introduce that.
Sure. In 1999, the Alabama Association of the Deaf were frustrated with the poor quality of services for deaf individuals here in the state. They filed a lawsuit against the Department of Mental Health at that time. It proceeded through the court process and was settled in 2001. I was hired in January of 2003. My first day, showed up, the lights turned on. I was the only one with the unit at that point. The program now involves 5 different regional offices around the state. We have a staff of 18 individuals. We serve almost 300 deaf clients and 1,500 the hard of hearing clients. We provide, well, and that's in direct services, by the way. We provide well over 16,000 hours of interpreting services annually to those consumers. We provide 3,000 somewhat individuals every year with training. We have an internationally recognized mental health interpreter training program here in the States. What else can I say?
Yeah. So you guys go from not having a department in 2001 to you getting here in 2003 to serving the entire community here in Alabama. You just went through the numbers how large that community is. What do you do your first day in office? What's the first thing that you do?
It depends on how you would define it. We didn't have an exact number of individuals at that point because, for one, there's no census towards that. Secondly, what's the definition of deaf? What we use at Department of Mental Health are individuals who identify themselves as a deaf individual, use American Sign Language as their complete communication method. That number goes around 8,000 individuals. Since the Office of Deaf Services serves over 800 individuals since we began, it means we've served 1 in 10 deaf individuals in the state.
So they're still trying to get your community involved and reach out to them, let them know that there are services so that they don't have to drop out of high school at 16 because they become frustrated. Let them know there's a community here.
Absolutely.
Yeah. Now, does the Alabama Department of Mental Health Deaf Services, did they directly provide services to individuals, or are other providers there in the mix like AIDB?
All of the above.
Okay.
We do provide direct services, provide psychotherapy, counseling, case management, but we also collaborate with our sister agencies like ADRS and AIDB. We work with our Department of Mental Health provider network as well. They provide direct targeted services for individuals. For example, we don't run group homes, but the mental health centers do. Mm-hmm. And we work collaboratively with them, work closely with the state hospital as well. We have a few deaf individuals who are there. Thank goodness we have a great reduction of deaf individuals in the hospitals than they had back in 2003 even.
Yeah, why is that, do you think? Why was there such that amount of hospital visits back in 2003?
We have options now. We have supportive apartments, we have group homes, we have better outpatient services to individuals who are living on their own. All of those items help reduce the number of individuals in long-term care.
Gotcha. Now, you mentioned something earlier about disability and mental wellness. That is something that's come up in conversation before. Do you see that link there? If you could describe disability and mental wellness together.
Individuals with disabilities are 5 times more likely to have mental disorders, according to statistics. Because of that, they need more attention to their coping skills, to developing better networking opportunities, to developing better ways of dealing with their own individual disabilities. Deaf individuals are very similar in that aspect. I can tell my own journey as well, and I also identify as a person with a mental illness as well. I do. Obviously, with my background, it shows much of that. I am both a professional in mental health and a consumer. The community should be focused on more development of wellness and less on reactive tactics to an individual decompensating. Why not find a better way to encourage wellness in the first place? Prevention, in other words.
Early intervention, I think, is a big thing there, where the quicker that you can get to the individual, the child, and start providing those services, introduce them to those services, the more long-term success that you will see there.
Absolutely.
Yeah. So would you tackle the challenges of disability first and then mental health? Or do you kind of take a holistic, we're going to encompass you with all of our services that we can right now?
Can you separate mental health from the humanness of an individual?
No, I don't think so.
It's the same thing.
Yeah.
A disabled individual is a human first. Their mental wellness is part of that humanness.
Yeah. Now, you mentioned if you can't get to those services earlier, that sometimes there is a crisis that comes about. What does that look like for individuals, families, and for the organizations that serve them? What was the definition of a crisis?
A mental health crisis is a situation where the individual is emotions, thoughts, or behaviors put them at risk of harming themselves. That's what we define as a crisis. In reality, crisis is defined by the individual experiencing it. If I think it's a crisis, then it's a crisis for me. For some individuals who have lost a loved one, for others, it may be a loss of a job. For some, it may be an increase of a culmination of years of stress, finally impacted to the point where a person can't cope anymore. It means a loss of ability to cope.
Have you noticed that more of these crises have come up during the pandemic in the sheltering in place environment?
It was an explosion of a lot of those situations, particularly in the deaf community. If you can imagine, we are already an isolated population, and now we've added the pandemic and the rules where we are put into more isolation. So yeah, absolutely, definitely. It was a very difficult situation. So we had to determine new ways to provide those services. Fortunately, technology has been an asset in an ironic way. It promoted more, it boosted the use of technology, video conferencing, applications were a huge benefit. I'm able to contact more individuals through video means. now. At the same time, our deaf community values face-to-face interaction. And we lost that for 2 years.
Yeah.
We're only now starting to see a return to that environment of seeing individuals that we've not seen for such a long time. We've missed a lot of contact during that time. So we see an increase of depression, an increase of anxiety. How do you get news? If you don't read English well, in some cases, how are you gathering news if you don't have that contact?
Yeah, I felt that myself. I enjoy getting out and meeting people face to face, being around other people, play hockey. I got to go do that stuff. I got to get the stress out. And when we were kind of shuttering in place, I felt that anxiety and that depression as well. And I'm glad that, we're able to have this conversation in person because it really energizes me. I really enjoy that. And it's part of my life that I need is to be around others for that communication. Now, we had a recent crisis in the deaf community here in Alabama, and there was a family where the mother and father were deaf, and they had 2 children, and the father there it was a crisis all the way around, and it was a big loss for the community. I did not know Mrs. Vance personally. But those that I speak that did know her say she was a great person, and it is a big loss for the state and for the community there.
Yes. Flo Vance was a very positive, upbeat individual, always friendly, very gregarious. It was an overall shock. Almost unbelievable. The community has had a very strong reaction towards it. There's been a lot of discussion involved in the community about improving access to those mental health services. But it was fascinating to me. Alabama is one of the best states in the United States for mental health services for deaf individuals. But it's not enough. We still don't have equivalent access to crisis services that our hearing peers do. I'm always humbled that we have made such strides and established some great things. We are a model for other areas in the country, but it's still not enough. We're not close to where we can have equity. We don't have equal access. It breaks my heart to listen to the community, and all I can say is, I agree with you. It's not equal. They can't just contact someone immediately and say, I need help right now. They don't have that same access. That's our next challenge. How can we improve those crisis responses towards deaf individuals?
And part of that response is the crisis centers that are throughout the state. So if someone feels like they are in a crisis, they can show up physically to that building and be seen and be taken care of.
Yes and no. Again, puts you back into Japan. Let's say you're in Kyoto, Japan, and you feel that you need to go to a crisis center. How willing are you to go and show up to that facility?
If I don't speak the language and I can't communicate properly, I would be pretty hesitant.
That's exactly the same perspective. So yes, they are there and they are wonderful. But what good are they to an individual who shows up who has the inability to speak that language?
But there are services available for interpreters if you need it, correct?
Yes and no. Again, how comfortable are you to work through an interpreter to express all of your deepest, darkest needs?
I've heard that come up in conversation throughout the broadcast, where somebody is maybe an adolescent and they're going through puberty, and maybe their mom or dad is their primary caregiver, and they're wanting to get into the dating world, and they don't want to have that conversation. And so, it's
Absolutely. Yes. Interpreters are important. I don't want to discount that or minimize that at all. But I can't trust an interpreter to deal with my expressions, my crisis. Now, let me tell you why. You're listening right now to one of my best interpreters in the state. Brian is one of the best interpreters that we could find here. You're listening to his rendition of what I said, his understanding what it is. You're not listening to me, you're listening to Brian's understanding of that. Those out in the audience are listening to that. They can see me, those who are deaf individuals can see me directly, but they're not listening to me unless they happen to know American Sign Language. Those individuals absolutely would understand me directly. When you're depending on an interpreter, Brian, to do that interpretation, Brian's word choices, Brian's what he envisions as what I said is what they're responding to, is Brian's decisions. Brian has an advantage. Brian works with me for more than 20 years. Brian actually was with me in Missouri. He knows me through and through, as well as anyone could. But let me ask you, let's say an individual shows up into a crisis center, and you've brought in bringing an interpreter. It's not that simple. There's not enough interpreters out there as it is. Well, that's fine. We'll go ahead and use remote interpreting through the screen. You have no idea who that individual is at all. That interpreter could have no background in deafness. And oftentimes, interpreters are not trained to work in crisis environments. So the crisis counselor is going to be depending on this interpreter who really doesn't know the deaf individual to work through this crisis. I'm sorry, but my confidence in that situation is very limited.
I can see where there's a disconnect of communication there as a third-party interpreter, but it's better than it used to be. I mean, I feel like having an interpreter, even having a remote interpreter, is a step in the right direction. Like you said, Alabama is a model to other parts of the country, but there's still a lot more that we can do. And as I understand, there are a lot of things under the crisis system of care that the state is doing, such as increasing access to services that are, potentially reducing arrests, decreasing admission to hospitals, trying to prevent what ultimately could become a crisis there.
The 988 initiative is designed to do that very thing. 988 is a national number being established by federal law back in 2020. Simply put, it is 911 for mental health. It contacts to the National Suicide Prevention Hotline, the Lifeline, which in turn will ferret those back out to local resources, local crisis call centers. That works well for hearing individuals. For deaf individuals, we are still struggling in that area, and we're hoping to work that out. I have been in talk with a major video relay service this week about how they plan to deal with this 988 calls. And they assure us that they do have mechanisms in place, but they can't assure that the interpreters that they take the call will be mental health trained. They have procedures in place for 911 calls, but those procedures have not been set up in 988, and they are not equivalent. it may be a while before we see an increase in the reliability of those services under the 988 initiative. Our major concern is that crises happened usually late at night, where our less experienced interpreters may be taking those shifts. That's a concern for me. If I wake up at 2 o'clock in the morning and I want to go order a pizza, that's no big deal. But if I call at 2 in the morning and I want to take my own life, I don't want someone who's just graduated from an interpreting program, who is still trying to figure their way through it. I don't want that person handling that call.
Yeah, they might be a little bit young for what you're looking for there. They're not as experienced to walk you through that experience. Now, just for anybody that's unfamiliar and might not have caught it, 988 is a number that you can call anywhere in the United States for emergency help with a mental health crisis. Anybody right now can pick up their phone and dial 988.
July 16th.
July 16th. So next month, is
It's
today the
not
16th?
there yet.
So we're 1 month out.
16th of July.
Yeah.
Right. So we are.
So in 1 month, anybody in the country can pick up their phone, dial 988, and they will be connected with a mental health crisis provider that can walk you through some steps and help you get services locally in your area.
Yes.
Now, you mentioned if you call 911 today, and I'm asking this because I didn't know this was a thing, but if I call 911 and I say I need video service, or how would I communicate that I am a deaf person and I need to use sign language in my 911 call?
In the same way that all relay calls are made, our relay agencies, wouldn't be calling you directly. You would be on the phone with an interpreter agency. You wouldn't actually see me.
Yeah.
I would sign. The interpreter would then provide the interpretation for that, much like Brian is doing right now, with the exception of you won't be seeing them in the same area.
Yeah.
Now, if you're in a crisis situation, that becomes more of a challenge. Interpreters can see me in this situation. They can describe what's going on with the 911 call. Oftentimes, I've heard stories about interpreters seeing terrible things happening within a 911 call. I actually used to train VRS, video relay service interpreters, self-care on this very nature, this very system. And some of the stories are mind-boggling. People have actually seen murders done on the video screen. They've seen children abused. They've seen rapes occur on the video screen. So how do we introduce another element to what is already, what's the reality of the deaf individual, what's the reality of the interpreter? In Tacoma, Washington, a number of years ago, I'll give you an example. We had a deaf individual who was being abused. Managed to get on the video screen, called a 911 call through the video relay service. They called for help. No one saw any beating on the screen at this point. She then ran outside, saw the police there, pulling up there, and she's trying to get their attention for help. The police thought she was the abuser and hit her with a taser. The victim calling for help, the police ended up arresting her, keeping her incarcerated for 3 days in the process with no interpreter support, no communication access, complete isolation. That's just one story. I can tell you there are dozens of others.
That is, I don't want to hear that story. I wish that story didn't exist. And I feel like the interpreter there should have told the police, or there was a disconnect there, that the victim is the one that has been signing and is the deaf individual. And you need to get a hold of her and make sure she's safe.
They did in this situation. But more to the point, the neighbors even tried to tell the police officer that this person was deaf. But when the person comes in their response mode, they're not listening to those other comments.
How do we do better? How do we train the police to do better in that scenario? How is the deaf community reaching out and asking for help in that scenario?
The old adage of train, train, train. We do provide training, but we have individuals come in with new hires. We have to do some retraining. Police may be exposed to tops 30 minutes of how to work with a deaf individual in that training. 4 weeks or 8 weeks of training all together, they get half an hour. However long it is, the exposure is at best 30 minutes.
It's not much. It's not enough to experience and have empathy.
It is not, no.
I think one of the most beneficial things parents can do for their child, if they're able-bodied or have a disability, is to put them in pre-K with others that are different, that have a disability, or to experience that, because then you grow up with that empathy. I remember one of my first, I was in like third grade, and I was helping do a little bit of babysitting. And one of the kids at my local babysitter spot had autism. And that opened my eyes to, okay, you know, this is just Chris. Chris is cool. He likes to do his own things sometimes. But I think having that experience early on in life can really help someone that's looking to go into the police force to maybe say, hey, no, you know, this reminds me of Steve when I was growing up. Let's figure this out together. To have that experience earlier in life. If I could mandate it,
yes.
Yeah. If I could mandate it, that would be every pre-K right there. So you mentioned that if you're going to dial 911 in the deaf community, that you'll go through your interpreter service. So that foundation is set up. Now it's just making sure that it gets implemented into the 988 here in maybe hopefully the next year or two.
Yes. The thing about 988 is it's not triggering a police response, but a mental health professional's response. Hopefully we can avoid situations like the Tacoma, Washington experience. Or even better, or even the Vance situation as well. The neighbors called 911, the police showed up. With no communication access there. With Billy Vance, there was no communication with them.
Yeah.
It may not have fixed the problem, but what if the situation were to occur later on, similar to that? You call 911, they send a police officer who can't communicate with the deaf individual in a mental health crisis. How does that help?
Yeah.
It's a good way to get a deaf person shot.
Yeah. Now, what exactly is going to happen when somebody dials 988? What is the process there? What can they expect? So, say somebody's nervous about calling. They feel like they're in a crisis, but they're nervous about making that call. What can they expect?
988 is based on the principle that you have someone who, if someone calls that number, it will have an individual immediately to respond, to deal with the crisis. That's our crisis system of care. 988 is a person to call. Whoever gets the call will be a person who's trained in crisis counseling. Their job is to triage in the situation, to screen an individual, assess them. Oftentimes, you can help an individual calm down, de-escalate, until they can get to a more professional counselor. Once in a while, you need to send someone out to meet up with them. That's part of the response. Again, frequently, interacting with an individual will help calm them down. Now, cooperate that with the mental health centers. We can hook them up with that at the later time. If they can't do that, we can go to a crisis stabilization unit where they can further calm down without having to go to a hospitalization or go into a jail, something different, something more comfortable, something more like a home environment where a person can just take a moment, be safe, And that's how it should work.
Mm-hmm. And the person that's on the phone that first answers that call, they will walk you through that process. So they will get in touch with a counselor if you need to see them tomorrow, or they'll get in touch with one of the centers if you need to go in today, or they'll call the mobile team and say, hey, we need some help on site. They'll take care of all of that.
It depends on the individual situation. Every call is unique. Every call has a difference. You meet the person where they are. You provide them the supports that they need for that particular moment. Follow-through assessment is the same way we do triage in the emergency rooms.
And what would you say to somebody that says, I think I'm going through a crisis, maybe not. I probably shouldn't call because other people have worse crises than I do, and they probably will just laugh and say, don't worry about it.
No one will laugh at you. As I told you earlier, the crisis is defined by the person experiencing it. Maybe to you, it might not be a crisis, but to me it is. A crisis counseling are trained to work with the individual where they are. It does not matter what other people think about them, what you think. If you feel you need help, you should call.
Yeah. And I would like you to kind of go through the spectrum of the level of care. So it could be your call and you just get to talk to somebody on the phone and they help you and you feel better and you get through that day till you can get to the next counselor, all the way to you can go and be seen in person and stay overnight if need be. Talk a little bit about the being seen in person, staying overnight, making sure you're safe facilities.
If a person does need to have a mobile response team show up, that person can come out there, meet the person there, talk more over with the individual. Sometimes even that individual person might cause the human contact might help to calm a person down, shows a person that really cares about you. It's not just a voice on the phone, for example. It's an actual individual. If necessary, they can also transport the individual to one of our crisis centers. The crisis center is there. Will they take him? They will not turn anyone down. They will take a person coming in at all. They can stay for 23 hours, up to 2 to 3 days, depending on the need.
And what is kind of the follow-up once that person leaves the crisis center to make sure that they're going to continue to succeed and get over their barriers?
We have a warm handoff to the local mental health center who will follow that person shortly after that.
Okay. So there's a continuity of care there for the individual.
Yes, exactly.
Yeah. And this goes live July 16th. I'm excited for it.
All the pieces are in place.
Yeah.
All over they're got to put, some are still out there. They're there, but they got to put them all together. But we do have our 4 crisis centers online this summer. We plan to set up 2 more as the time goes on. We have several rural mobile response teams. Those should be online by next year. So we're expanding the program. Tying back though to deaf individuals, I would like to see a national lifeline for deaf individuals with mental health crises.
Specifically for the deaf community.
Yes. That's what I've been advocating for the last year and a half within this initiative. If you look at the toolkits that are being produced out by SAMHSA, the Substance Abuse and Mental Health Services Administration, you will see that there's a call for establishing a national video phone number for those individuals to have a crisis response line. I'm excited to see, and I'm hopeful that that's going to occur.
Has there been progress up in DC on that?
There appears to be, yes.
Yeah.
The worry for me has always been, will it get lost in the shuffle?
Yeah.
Everything that's going on overall in the system,
Mm-hmm.
I want to see that not get lost. So I don't know if that's the case.
When July 16th, when 988 is up and running, I am tempted to call and go through a little bit of an experience, just so if I have a family or friend that I can kind of walk them through that and what they expect. And so I have an alarm system, and they say it's good to set it off every year just to make sure it's running and you're familiar with it. I'm tempted to call 988 and just so I have my own experience with that. And so I could tell a friend what to do. Should I not do that?
If I ran a live blog every week, I might have anxiety to do it myself, but I can't tell you whether to do it or not.
Yeah.
I myself am tempted to try it.
Yeah.
As a deaf individual, I may do so.
Yeah. I think it's good to test those kinds of things. What are some exciting things that are happening for the deaf community, maybe in the past few years that they may not know about yet, and some things that are on the horizon?
We are working to try to add a deaf crisis stabilization center. It's a challenge. The challenge is heavily fell in staffing. You've heard of the mass resignations that have been coming across the board. That is impacting our ability to hire as well. But we're working on it. We envision to have this similar crisis stabilization center for deaf individuals to go to in conjunction with our deaf hub at Bryce Hospital.
I've heard of Bryce Hospital. I've never been there. I have a side question. Have you seen more individuals get involved with interpreting or less individuals? Are there more interpreters coming through the program today than there were 10 years ago?
I'm not seeing an increase per se. I'm seeing some more retirement coming out. We are having people retire faster than we can replace them.
Mm-hmm.
COVID did not help.
Yeah.
Shut down interpreter training programs for a while, forced some of them to go online. Online learning of a visual language like American Sign Language, it's okay, but it's much harder to correct nuances in the language. You're losing the 3D language when ASL is a 3D language. I'm not sure if I'm explaining myself very clearly at this point, but interpreter training has always been based on live modeling. The pandemic really hurt recruitment and retention of our interpreting individuals. Not just interpreters. There's a bigger problem. Counselors, social work programs, those who are looking for people who are sign fluent, as they graduate can go work directly with deaf consumers. As an over-reliance on interpreters out there as opposed to those direct services providers. We have counselors, more social workers, more psychologists who are able to communicate directly. We have no psychiatrists in Alabama who are fluent in sign language. None at all. We have one deaf psychologist. It's not enough. So I would like to see more investment in finding individuals we can train to become direct care providers, direct services providers.
Now, what can someone in the Alabama care community who is familiar with the disability community, maybe as an individual or family member, but may not be deaf, what can we do to support the deaf community, or what would you like us to do to show that support? The biggest one is recognize we're here.
We've often been called an invisible community, often. When has, suicide or a murder happen where it comes out there? It doesn't happen that often in the deaf community, but when it does, it's much more recognizable. Help us to educate that interpreters are not the only solution. Develop more direct signing programs is very beneficial. Help us find people to do the work in our group homes, working in the Deaf Care Hub. Right now, we're at such a shortage trying to find individuals to work in these particular positions. Most of all, include us. I cannot tell you how many times decisions have been made that impacted my life that I had no say in. It's a frustration to me. I feel like I'm the only person screaming at some point, but I'm in the forest. It'd be nice to have some other voices out there saying, hey, what about deaf individuals?
Yeah, everybody needs to be at the table, especially when the decision making is going to affect you personally. And I think we see a lot of that change in mindset coming at all different levels. Like for my family member, she has a person-centered plan that she designs her own goals, those types of things. It's all centered around her. And so I think we're seeing that mindset shift and be implemented more there. Another side question, you mentioned that sign language is kind of a blocky language where you'll absorb the communication in little bits and chunks, and it's a lot less single words. I've heard that some Chinese and Japanese is also like that, where the characters mean a few different words at one. I'm wondering if there's, I don't know if you have any understanding, if you know Japanese, but is it kind of like that where you'll see it's more characters and you're absorbing and communicating in blocks of text?
You're thinking like a very strong Anglophone.
I don't know what that word means.
Anglophone is very English-focused, English-centered. If you compare any two languages out there, you will see structural differences. You took high school Spanish.
Yes.
You mentioned. The language structure is different than that of English. Similar situations we find in American Sign Language. The structure is different. So yes, we do have idioms, we do have our ways of phrasing items that require some English translation. That requires a great deal of English translation to get equivalent. Spanish will have ways of phrasing things that require a great deal of expansion in the English language to make it equivalent. But it's not really a word for word interpretation or equivalent. It's not.
Yeah. I would like to shout out, we did a broadcast with the partnership between AIDB and the Presbyterian Home for Children at the Union Village that's going on in Talladega. It's a community of a little bit smaller homes, but is continuing to grow there. And the individuals that we've been able to speak with at both organizations and those living there at the Union Village say they absolutely love it. Do you see more of these types of communities popping up throughout the state of Alabama?
It's a numbers game. Deafness is a low incident population, so I don't see necessarily seeing a lot of establishes, not of the villages being set up across the state. I like to see more supportive living apartments out there in the state, so people do have more choices. Right now their choices is Talladega or nothing. I would like to see a little more options pop up out there.
We see that also in the IDDD for my family member and for others receiving services is community integration, choice of environment, affordable housing, and the housing is crazy right now. Rent is through the roof, but got to try and navigate that. Are there any upcoming events or newsletters that you would like to highlight and recommend people join or attend, be a part of?
Our largest event is coming up fairly soon. We have our annual mental health interpreter training. This will be our 20th year doing this. We have trained around 1,300 interpreters across the country in the last 20 years. Many of them are repeat attendees who come more than once. The information is updated regularly. It's internationally recognized. We have received an award from the Chamber of Linguists of England, the Charter of Linguists in Great Britain recently. We've had attendees to our training from 7 different countries. Almost annually, we have some individual from a country outside of the United States. That will happen the first week of August, August 1st through the 5th. We do publish a newsletter. We say it's quarterly. It's more like it's more like 4 or 5 months sometimes. It depends on when the editor, me, takes the time to be able to complete it. But if you are interested in that, you can go to our website at mhit.org. That will tell all the information. It will include areas where you can have a link to our newsletter on that page.
Melissa has given us the link previously, so we're going to go ahead and put it in chat so that others that watch this broadcast can click on the link and get to the newsletters there. You mentioned that here in Alabama, the training is recognized by the Charter of Linguists in the UK. And I want to ask, with your experience internationally, how does America fare for the deaf community as opposed to other nations?
That's a loaded question. Some areas we're ahead, other areas we are lacking, as with anything else. For a long time, England was well ahead of the game, well ahead of us in their mental health services for deaf individuals. They established direct care services in British Sign Language there. We're catching up. I am one of 2 members for the International Initiative for Mental Health Leadership, specifically related to deaf individuals. I'm one of 2 members on that group from the United States. We can compare services across the board. We'll always say, you have it better than I do, or you have it better than I do. We're often saying that whatever perspective you look at, somebody has some areas where they are better off.
Do you notice that on an international stage that there are the similar movements that are going on here in America and in Alabama?
In some manners, yes. The crisis system of care, for example, is an international initiative. I am not seeing that dialogue related to the deafness aspect of it. I'm supposed to be involved in a discussion actually this fall towards that. We're going to have a web-based meeting run by New Zealand to discuss the need of a crisis system of care for deaf individuals.
Yeah, so it sounds like people are starting to say, hey, we want to know how to help. We need to start having these conversations. We want your input because you know best. Yeah.
Exactly right.
And the last question for today is there anything that we haven't talked about that a child maybe that is having some hearing loss, or a parent of a child that is having some hearing loss, could benefit from hearing today from our conversation?
You saved the biggest question for last. Parents who find their child has a hearing loss or is deaf, they go through a time of grief, a time of shock. I can advise just 2 items in this particular. One, start a language exposure early. Don't limit the child to what your approach or one approach or another. Life is a series of choices. It's like a buffet. Try them all. AIDB is very good at early intervention services. Make sure to get in touch with them. Find deaf adults out there. Expose your children to deafness and see that deaf people exist out there. I can tell you a story on my own experience. During my internship as a counselor, I was called to a rural school in Kansas. There was a boy, age of 6, a deaf individual, 16. Who was threatening to take his own life. The school happened to know that I was deaf, and I was a counseling intern. I had the opportunity to borrow me from my placement, so I went and did some work with this teenager. As I arrived there, 30-minute drive outside of town, out in the country. I come in, I'm looking for where this boy is. I can't find him anywhere. I notice that there's a window that's with some cabinets below it, and doors slightly ajar, and this child is sitting under the cabinet. So I sit down on the floor with him. I say, hello, hi. He's covering up his head. I sign to him, hi, I'm deaf. You're deaf too? He looks to me and says, are you deaf? Yes, I am deaf. You can't be deaf. Well, but I am deaf. I am deaf. I encourage him to come out here and we'll talk. He comes out and sits down. Come to find out, he was experiencing a great deal of depression. He had never seen or met an adult who was deaf. And he had just become 16, so his thought was, they don't exist. Thought he would die.
He felt very isolated there.
Yes.
It's so important to have that connection with others that can go through the experiences that we're going through and maybe have been through to help guide us through that, so we know that we're not alone.
Yes.
I would say another thing, I would recommend, learning about somebody in the deaf community that you view as successful long-term, almost like a hero. And I would say, sir, you're a hero in the deaf community. From 16 years old, dropping out of high school, to helping multiple states and departments in the deaf community. And then on the international stage, as a force to reckon with there. Thank you.
Well, thank you. I just do what I can.
I think you're doing a whole heck of a lot. Mr. Hamerdinger, I want to say thanks again for giving us some of your time this morning, letting the Alabama Care community know everything that you and the department are doing for the deaf community and for mental wellness here in Alabama. We look forward to the continued increase in the mental crisis facilities and the 988 service that's going to be coming around next month, and your continued support. So thank you once again.
Thank you for inviting me.
And at this point, we'll kind of give a wave to our cameras, and we'll say, see you guys next time.